Can you believe it's been 2 years since South Africa hosted the Global Citizen concert with pledges totaling a whopping 7.2 billion US dollars. That's about 104 billion rand. Well, so far, Global Citizen South Africa says that about half of those pledges have been fulfilled and that 105.4 million lives have been impacted by those pledges and 14.6 million in South Africa alone. However, there has been criticism of Global Citizen just being a talk shop with celebrities at the helm and no meaningful impact actually being done on the ground. Let's talk about that. We're joined now by Chebet Chikumbu, who is the Regional Director for Global Citizen, and Davor Dakovic from the US President's Emergency Plan for AIDS Relief, or PEPFAR, one of the organizations who have benefited most from the fund. Good to have both of you. Thanks so much for joining us here on Morning Live.
Good morning.
Good morning, and thank you for having us. Good morning to you, listeners and viewers.
Absolute pleasure. So, talk to us about the impact those Global Citizen pledges have actually had on South Africa since the 2018 Volunteer Initiative and Concert. I'm not sure who wants to take that, but perhaps we can add this question to you first up from Global Citizen as well. So let's talk to you, Chebet, about this one.
Thank you. In the 2 years since the Mandela 100 Festival, as you've rightfully pointed out, we have successfully seen the delivery of more than half the commitments that were pledged on the stage. $7.2 billion was pledged at the Global Citizen Festival on the 2nd December 2018, and to date, $3.9 billion has been dispersed to the various interventions. The really great outcome for us is that 105.4 million lives have been impacted as a result, with 50 million new lives impacted in 2020 and 14.6 million lives in South Africa alone. So it's really significant, and working alongside our commitment makers like PEPFAR has really helped us in understanding the innovative ways that our commitment makers are addressing the pandemic needs of COVID-19 while still advancing their core goals. And so really great to have Davor here, who is a beneficiary of the work that PEPFAR is doing on the ground, not actually from PEPFAR, but from CRS, and I'll leave him to speak to that in a little bit. But that has been really just part of the intervention that we've been seeing in Global Citizens answering the call to be the generation to end extreme poverty.
All right, let's bring you into this and ask from a beneficiary's point of view. How has it been for PEPFAR, and perhaps talk to us about how it has helped your organization?
Yes, thank you, Chebet, and the host. That's correct. I represent the organization called Catholic Relief Services, CRS. I wouldn't call ourselves a beneficiary of PEPFAR. We are rather an implementing partner of an organization that has been active in South Africa for about 20 years, about 80 years worldwide. But in the country, we are working under what is known as South Africa Surge, which is a joint initiative of the two governments, of the South African government and the American government through PEPFAR, to help bring about 2 additional million people to HIV treatment. This all goes back to the time in February 2018 when the South African president, Cyril Ramaphosa, announced a bold plan to provide life-saving antiretroviral treatment for these additional 2 million people, on top of the 4 million who were already on treatment at that time, living with HIV in South Africa by 2020 and beyond. In order to support the government of South Africa to increase demand for and access to efficient and quality HIV services, CRS, the organization that I work for, has received support from CDC, which is the Centers for Disease Control and Prevention, and partnered with the local faith-based organizations in the country to encourage social mobilization through partners and community organizations, generating demand for HIV services and ensuring linkages to services, HIV testing and treatment services, as well as providing community-based services for populations with a particular focus on men and adolescent girls and young women. Just to note that these multi-faith local partner organizations that we have partnered with include colleagues from Catholic Church, of course, the Muslim AIDS program, Lutheran Church, Methodist Church, KATKA, and a multi-denominational group called KZNCC in KwaZulu-Natal that has important outreach to the traditional leaders and traditional health practitioners. And so over the last 2 years of work under this South Africa surge, we've achieved some great results, something that we really have a lot to be proud of. Just as an example, what they call the demand creation, which is essentially creating demand for HIV testing or treatment services. We've insured services to HIV testing to about 130,000 people over these last 2 years, of which about 21,000 have been confirmed to be HIV positive. And they were, of course, brought on antiretroviral treatment through either the government clinics or what is known as PEPFAR DSPs or PEPFAR district support partners. Throughout the country, we were active in 6 provinces out of 9. Overall, more than 90% of people living with AIDS that we have been able to identify were linked to care for antiretroviral therapy. And about 51,000 people who interrupted their antiretroviral therapy were traced and relinked to a facility.
Okay.
We all know the difficulties involved in getting people who once stopped treatment to bring them back to treatment. And I think our field team have managed to do some great work in that regard.
Good. We're happy to hear that and a report back from you. So, and also just apologies for saying that you are from PEPFAR. You're not from PEPFAR, as you have pointed out to us. So thanks very much for the clarification. We have also fixed that on our side. But let's talk about some of the numbers that we had here, Chebet, which we spoke about. 14.6 million lives in South Africa have been impacted for the better by Global Citizen. What do you mean by that? I mean, what is impacted for the better and such a big number? What have you done?
So in addition to the intervention from PEPFAR that Davor has just spoken about in addressing the HIV epidemic control, other partners that have really come to the table in their delivery have been the likes of Cisco, who committed to preparing 10 million people to work in the digital economy. And what that is essentially thinking about the skill sets that are needed for jobs in the digital economy. We're happy to share that to date, Cisco has prepared 4.5 million people to work for jobs in the digital economy. And in 2021, they're going to be ramping up that effort by working with about 30,000 instructors at 11,800 learning institutions in 180 countries in 2021. And that's just one example of a partner that is supporting the development of human capital. Another example in that regard is Vodacom is connecting South Africans by improving and building critical 4G and 5G network infrastructure. They've deployed and accelerated their fiber rollout. And this is something we can really connect to in terms of the data usage surges and connectivity demands that we've had, especially as we're working from home and educating from home. And Vodacom has really stepped in this gap in ensuring that those who reside in townships and deep rural areas of South Africa have access and that they stay connected to their families and their businesses are able to continue operating. They're facilitating online learning under the difficulties of COVID-19 and assisting the government in providing critical services. And they've impacted 95,000 households as a result of this introduction in boosting connectivity and launching their first commercial 5G network in South Africa in May 2020. So those are 2 examples of partners. And then the government of South Africa also has delivered and made good on their promise to deliver $11.1 million in free sanitary care for girls across South Africa as part of its commitment to menstrual health. We know that the lack of access to menstrual health management continues to be a barrier to girls' education. And the outcome of this is that 1 million girls have benefited from this commitment, and 6 South African provinces have prioritized menstrual health management programs, focusing specifically on education programs as a result of this intervention from our government. So this is really just a view of some of the commitments and follow through that we've seen from our Mandela 100 commitment makers.
Oh, obviously, I mean, the impact of coronavirus is there. I mean, you did mention it, and so many people have, unfortunately been affected by this all around the world. And I mean, this is just, it's people that may not have been below the poverty line are now below the poverty line because of COVID-19. And this particular initiative happened way before we ever knew that this was going to happen. Can I ask you, in terms of vaccine, I mean, are Global Citizen a part of COVAX at all? I mean, we know that the Gates Foundation is, and the Melinda and Bill Gates Foundation committed $17 million towards the expanded special project for the elimination of neglected tropical diseases. I just had to add that in. So that's just a question, and we're wondering if there is assistance there.
Well, in 2021, as we look into our advocacy priorities and our campaigning plans, we are certainly prioritizing addressing the health crisis that has been brought by COVID-19. As you pointed out, we've seen intensified marginalization as a result of the pandemic. An additional 150 million people are expected to be plunged further into extreme poverty. And that was, that's the case now. And before COVID-19, we were still off track in meeting the global goals. So one big priority that Global Citizen will be focusing on and working tirelessly with our global partners is ensuring that we can recover stronger together, and that the essential needs and services need to be prioritized. We will be working in raising funds and helping to address the financing gap on the ACT Accelerator that is part of the WHO's comprehensive plan to ensure that we're able to get the vaccine that is needed and that it is equitably distributed. So that will be a big priority of Global Citizen, while focusing on the other crises that we've seen, such as the hunger crisis, what's happening to our environment and protecting the planet, but also the racial and gender inequalities and addressing the equitable outcomes that are needed in that regard. So really taking a holistic approach, and we'll be rolling out a 5-point recovery plan to that effect in 2021. And we'd like you to just keep your eyes and ears peeled for those plans, as they'll be communicated on our website, www.globalcitizen.org, or through our social media channels.
Okay. All right, let's leave it there for now, but I just want to ask one final question, if you can, very quickly. Davor, talk to us just briefly about how COVID-19 has affected your organization as well. And I can imagine the battle with HIV and AIDS is also being impacted.
Certainly, yes. In the early days of the lockdown, in late March, early April and onwards, our field teams and those of our local faith-based partners faced significant and numerous problems, starting from simply being able to access certain areas due to the lockdown and their inability to move. Luckily, in active collaboration with the Department of Health, we were able to resolve these issues, and they were all issued permits so that they can move freely throughout the communities that they serve. Unfortunately, we have also lost a number of our colleagues from our faith-based partners due to COVID. We have at the same time been very active in obtaining, purchasing and distributing the PPE, hand sanitizer, the masks and gloves and so on and so forth to our teams so that they can continue doing their work. They have also been actively supporting the Department of Health in demarcating the Department of Health clinics and hospitals throughout the country. I believe we've completed about 240 such facilities so that the Department of Health teams can do their work. as well as, even though this is not a COVID project per se, but it is an integrated HIV and TB support project, we have been supporting the government by doing some of the initial COVID screening, so that of the patients that we serve with HIV and TB services, so that those who are identified as what they call possible COVID suspects, that they can then go and get proper testing for COVID by the government, and thus relieving that pressure on the government laboratory services.
Okay, thank you so much for joining us, both of you. Chebet Chikumbu from Global Citizen and Davor Dakovic from an initiative that is benefiting from the Global Citizen, benefiting from PEPFAR, but also from the Catholic Relief Services. We had to just correct that one in terms of position.